Hi, my name is Pete Maines. I'm the co-host of the Liberty Starship podcast, and this is our first ever minisode, so this is going to be a bit of an experiment. I want to talk a little bit about this false dichotomy between the economy and health. We've all been hearing that about 2 million Americans could die from the coronavirus, and I believe that. Just looking at the data, I don't have any doubt that this virus could kill up to 2 million Americans. This could just be the beginning. If 20 or 30% of American workers are suddenly thrown out of their jobs, what do you think could happen? We could see riots in the streets, we could see a revolution, we could see Americans fighting each other in a way that we haven't seen since the American Civil War. It could be absolutely terrible. And so I don't think we have to choose between the economy and health. I think we need to keep Americans healthy, but we also need to figure out how to get Americans back to work. More Americans need to do telework. We should already have been doing that. More people should work from home. It just makes sense. It's frankly just a lack of imagination and the effective momentum that people don't want to change. But now we have to change, and so that can be good. But we had 3.5 million unemployment claims in just 1 week, which is more than the entire 2008 crisis combined, if I'm not mistaken. Just looking at the chart, I don't see how you add all that up and get 3.5 million unemployment claims during the Great Recession of 2008. So I think the economists are right when they say that we could have 20 or 30% unemployment here very quickly. So I was looking at where we could, and I'm putting on my central planner hat, and I don't believe in central planning. I believe in liberty. But if we're sort of trying to imagine a way forward, saying this is a crisis, how do we come together and plan the future a little bit? I looked at the labor statistics of what are the fastest growing jobs in the United States. And a lot of them were things like working at a store, being a salesperson, being a server at a restaurant. And right now, those things just aren't practical. But the thing that was practical is a lot of the highest growing jobs, about 5 or 6 of the major categories, all had to do with healthcare. A lot of them were different types of nursing. You had licensed practical nurses, licensed vocational nurses, registered nurses, nursing assistants, home healthcare workers, and personal aides. And not all of these were good paying jobs, but we have 3 million or so registered nurses. And right now we need a lot more. Now, Congress just passed a $2 trillion stimulus bill, and we've dumped trillions more dollars onto the economy through the Federal Reserve. If we had wanted to do that in a smart way, what would we have done? Instead of sending everybody $1,200 checks, maybe we could be training nurses right now. For $60 billion, we could train 3 million nurses. Now, we just had 3.5 million people file for unemployment. What would happen if we suddenly opened up 3 million nursing jobs? Now, that may sound like a lot to double the number of registered nurses, but over the next decade, maybe that's exactly what we are going to need. So, wouldn't it make sense to start training people now? Half of our healthcare costs have to do with personnel. And nurses come out of school with about $20,000 of debt. If we paid $20,000 for 3 million nurses, we could train them for $60 billion, and it'd be a small fraction, just 3% of what we just spent on the stimulus. So why aren't we doing that? Why aren't we investing in education of something that we know we need? Because here's what's going to happen. In about 5 years, we're going to hear from politicians that there's a shortage of nurses, and we need to import people from other countries to fill those jobs because Americans won't do those jobs. And I don't believe that. I think Americans will do these jobs, and I think immigration is great. I think immigrants do great things. They start businesses, and they're great assets to this country. But if our plan to fill jobs is always just to import people from other countries, we can't then turn around and complain that there are no good jobs. It's just hypocritical. So I want to talk about this false choice that we can be libertarians and we're not going to have to pay for healthcare at the federal level through the government. Well, we already do. We spend about $1 trillion a year at the federal level, and that's not counting what the states pay. About $1 trillion at the federal level on healthcare. And mostly the way we spend it is by paying for people's medical bills through Medicare or through Medicaid. You have Obamacare, you have a lot of programs. But what if we instead increase the supply? What if we trained a bunch of new nurses? What if we brought down the cost of education for health professionals. So that way they're not saddled with a lot of debt. And we don't have to then pay them indirectly for their health care plus interest. What if we make a capital investment now in healthcare education? Train a lot of new nurses and PAs and doctors. That way, they're able to work for less because they don't have these bills hanging over their heads. And it'll make their lives less stressful because debt is stressful. Make their lives better, and everybody wins. Instead, we're paying the doctors, who then pay the schools, but they also pay the banks because they have all this interest. Why are we paying interest when we could be we're putting down $2 trillion anyway, so we're going to pay interest on that no matter what, right? It's a $2 trillion bailout. We put on the credit card, fine. I don't think that's necessarily a good idea. I think we're going to see really bad consequences from that in the near future. But what if we had instead taken that stimulus money and invested it in something durable, the American people, invested it in our workers? I hope you like this mini-sode, and please like and subscribe. I hope to see you soon. For Liberty Starship, this is Pete Maines. You keep flying free.